Lesson 2. You need to explain to the mother of a young child that her little pride and joy has tooth decay and tell her what needs to be done. Then explain to the 6-year-old what you're going to do. So take a minute to think about your own approach to this scenario, and then we'll look at some tips to tackling this. So I would agree, don't just jump in with it, but there's no point tiptoeing around it either. With pleasantries out of the way, explain that the child has tooth decay. Show empathy by not being cold or overly formal. Little Sarah here needs some fillings. I know it's not what you want to hear, but the good news is she's in the right place and we'll get her sorted. The mother may get upset, cause a fuss. This is just to generate a bit of stress and put you on the spot. Don't get caught up in all this emotion. Be pragmatic and methodical and explain what needs to be done without losing that human element. Investigate what may have caused this. Teeth don't just rot. Either there's not enough brushing, too much sugar, or a combination of the two. This is an opportunity to involve the child in the conversation. They are the patient after all. Also, I find that children are much more likely to tell you the truth about all the Mars bars mummy's been giving them. So you've solved the source of the problem. You've advised mum and child that the amount of sugar and the frequency of sugar needs to be reduced because we don't want any more pearly teeth that'll cause pain like this one. Now you can discuss the different treatment options. Is this a straightforward filling or is it going to need a crown over the top? Use child-friendly language so both can understand. And then this avoids frightening the child as well, who's no doubt listening. You can explain that the tooth needs to be put to sleep. You don't have to say you need to bang a 27 gauge needle into the back of their throat until it hits bone. Child-friendly language. Children tend to be nervous patients. Explain that if they want to stop at any time, they just have to put their hand up. This puts the child at ease and shows that you're empathetic and that you acknowledge that, yeah, of course, a 6-year-old's going to find it uneasy and stressful having fillings done or whatever else it is. Even sitting in the chair is quite daunting for most 6-year-olds. So it's extremely unlikely you do a root canal on a 6-year-old. But if a similar type scenario comes up, you can explain to an adult patient, yes, it's a pity that we need to do this, but the good news is it gives us another chance at saving this tooth. Root canal involves removing the nerve from the inside of the tooth and packing it up with our own rubbery material to stop bacteria and bugs moving up it. A good answer will involve simple language. Don't use overly scientific language, just assume that neither mummy nor patient have any prior knowledge of dental terms, and this will likely be the case. Instead of saying crown, say cap, and so on. Identify the problem and explain it to the patient as well as the next steps. Often I will say to patients, could you just repeat back to me what the plan is so I know I've explained that properly? If someone doesn't understand something, it's your explanation is the issue. So use a child-friendly language is important, but don't beat around the bush. Ultimately, it's your job to fix the bad tooth, and you can't do that with kind words alone, unfortunately. So remain calm. Most people find getting fillings stressful on some level, and the last thing we need is you freaking them out on top of it all. And remember, it is an exam. You're being assessed for your performance under pressure. If you don't know the answer to something, be assertive. Say, I will find that out for you. And to say you don't know is just being a bit dismissive. Bad answers, they'll use a lot of jargon. The child doesn't want to know about the distal caries in the upper right E. They want to know, can you fix it and is it going to hurt? Don't jump in too quick. Give the child time to process what's going on and acclimatise their surroundings. You have to take care with children. Freya comes in to see you, her dentist. She's a teenager who isn't bothered about her oral health, and you need to explain to her why it's important to look after her teeth. Before we get started, like before, have a think yourself about how would you approach this. So explain the risks of tooth decay to her. By not brushing your teeth often or well enough, there's a build-up of food debris and plaque. Bacteria feeds on this, and then the byproducts of the bacteria result in tooth decay. Explain what can be done. Advise her to limit the frequency and amount of sugar she's having. As she's a teenager, it's very likely these are going to be her adult teeth. So if she doesn't look after them, another set's not going to appear after them. Patients should brush their teeth twice a day for 2 minutes, including last thing at night. Once brushing, don't rinse out with water, but spit instead. This is because the toothpaste has got fluoride in it, which strengthens the teeth and the hydroxyapatite within the teeth, so we don't want it washing away. It's important to be supportive but not accusatory. You need to explain to them the importance of maintaining good oral health. For behavioural change, the patient has to understand why it's important that they follow your advice, not just finger wagging. I'll often say, I'm just going to talk you through some tips and tricks to help you brush better, as there's decay there, so obviously there's something not quite right with your technique. and I'll help you out with that. This avoids embarrassing the patient by saying, oh, you don't brush your teeth. Because quite often they do, and it's just not being done properly. But this still addresses the important issue that she needs to start taking better care of herself. Bad answers tend to be rude or confrontational, though I do think it's important to be stern. This can be done without rudeness. There's no need for rudeness. It's not good enough to say, oh, you need to improve your oral health. You should explain to the patient how to better look after themselves. If you find yourself, this applies to any of the stations, becoming a bit flustered, take a breath, have a think, and start again. Remain calm. You're only telling someone how to brush their teeth. It's easy and you know how to do it. So a child, Sahalab, 7 years old, needs one of his teeth removed. His mother, Aisha, is extremely anxious about the procedure and has a few questions for you. What is a tooth extraction? How does it work? Will my child be under sedation? After answering these questions, she'll ask you to tell Sahab about the procedure so that he's aware of what it involves and to persuade him that it is necessary. He has severe tooth decay and this is really the last resort treatment. What is a tooth extraction? This is the removal of the tooth when it's beyond repair. Everything else has been tried and it's knackered, it needs to go. If it's a baby tooth, you can reassure the mother that an adult tooth will come in its place. It'll be along shortly. We never put children through an extraction unless it's absolutely necessary. The tooth in its current state is a potential source of infection, could flare up, could cause pain at any time. It needs to be dealt with, no doubt. How does a tooth extraction work? Your child should not feel any pain at all, as we use numbing cream followed by an injection to put the tooth to sleep. We will then use some instruments to loosen the tooth and then remove it from the socket. Will the child be sedated? So our top priority is to ensure that your child is safe and comfortable during the treatment, and that also you feel safe and comfortable as well. So we have sedation and anaesthetic options to help your child relax. We use nitrous oxide, or laughing gas as it's more commonly known, to make your child feel less nervous and anxious. It wears off quickly after the procedure, so your child can be back to normal very quickly. Not always a positive, is it? We will also offer oral conscious sedation for children that have more serious anxiety. So there are other options there for dealing with particularly anxious children. This can be a tricky scenario. Again, stay calm. Sure, you don't know exactly how an extraction works, but you'll know more than the patient or the actor. Dental extractions should be pain-free. You'll still be able to feel the pressure and the pulling, but none of the sharpness or pain. Lots of weird noises are to be expected as well. I always tell this to patients before I start an extraction, so they aren't freaked out when the tooth invariably snaps. If you think of how close it is to your ear, it sounds so much worse to them as well. This question is about empathy. Show that you appreciate that for a child to have an extraction that can be traumatic, and that you're going to do everything to ensure that this trauma is limited, i.e. offering the sedation. You should explain and emphasize why the tooth has to come out. We don't take the teeth out because we're sadists. We do it ultimately to protect and help the patients from further disease and pain. It's cruel to be kind is how I would describe it. But then it's completely numb. Ensure the patient or actor understands what you're saying. Ask them questions. Get them to talk through what their understanding of the procedure is. This way you know they've understood and therefore are properly consented. So remain professional throughout. A mother crying isn't cue for you to start crying. Now for explaining to the child themselves. They don't need to know each gory detail, but they should be prepared for what's going to happen so they're not taken off guard. Talk calmly and simply. Explain that if they want to stop at any time for any reason, raise your hand. This gives the child the control and puts them at ease. This also works very well for adults as well. Failing this, try some good old-fashioned bribery. Dentists don't give out lollipops anymore because it sets a bad example, but stickers are fine, or even a sample toothpaste can do the trick. Start your bidding low. Usually a sticker is good enough. Sometimes I up it to 2 if it's been particularly dramatic. With children, it's important to be friendly and smile. Think Miss Honey from, Matilda. Even though the parents are the ones who give consent, always involve the child in the conversation and speak to them together. If Soal is difficult, don't let him put you off. Be persistent. Ask the child what it is they're concerned about. Usually they won't hesitate to tell you, and you can offer solutions to this. Oh, I don't like needles. Oh, is that right? Well, we have some special magic numbing cream to stop it hurting. It's quite simple stuff. Bad answers. Bad answers will go into too much jargon and technical depth. The child doesn't need to know exactly how you plan to prise the tooth out of their skull. Yes, I've said use child-friendly language, but don't be patronising either. They're a child, not a moron. Children are better at picking up insincerity than they're given credit for, I think. This whole station is about keeping your cool and communicating effectively to acquire proper consent. This slide is an example mark scheme that may get you showing the sort of things the examiner looks for. Pause the video and have a good read through of the categories being assessed. For each one, you basically get marked as to whether you answered poorly, average, or good. Straightforward. Patients don't always remember everything they wanted to ask you. Continuously prompt them throughout the consultation to encourage them to ask you more questions. Your patient has attended for an emergency appointment. You last saw the patient a month ago while you were providing a filling. The patient presents with pain and now requires a filling to be replaced and an extraction of the tooth adjacent. Explain to the patient the treatment plan, including costs, and discuss the reasons for treatment and the risks. The treatment plan. So this is from a previous Band 2 treatment. Band 2 treatments consist of fillings, extractions, gum treatment, denture reline, denture additions, I believe, root canal treatment, fissure sealing, splinting, and whatever else. No added cost from the initial filling. So if a treatment is required within 2 months of completing the course of treatment, there's no added charge if the treatment is from the same or lower charge, if that makes sense. Guarantee provided for similar treatments. So fillings, root fillings, crowns, inlays, veneers, they all have a 12-month guarantee after the date of completion, on the NHS anyway. The procedure itself. Patient will be given local anaesthetic to numb the area so it'll be less painful and less uncomfortable. Treatment is quite urgent, so it'll be carried out really as soon as possible. Any treatment carried out must have a diagnosis and be justified. You have a duty to your patients to explain why you're doing a particular treatment. In dentistry, the reasons for treatment can be put in a few broad categories. Get rid of pain or source of infection, to improve and restore the function of teeth. So helping you chew, helping you speak. And then lastly on the list is aesthetics. A big topic in healthcare at the moment is about sepsis and the rise of antibiotic resistance. This is why it's important that poorly teeth are dealt with, either be extraction or drainage or of an abscess or whatever it is. This removes the risk of infection entering the bloodstream and causing a much more serious problem than the original toothache. All treatments come with some level of risk. I've had a very similar scenario myself during the week. Patient came in, needed a big filling. I did it, seemed straightforward. Next day they came back, they've been in agony since the local anaesthetic wore off. So there is a risk that even when we opt to save a tooth, that it can be unsuccessful and require extraction anyway, and there's just no way around that. The procedure of extraction has some risks in itself. You can imagine teeth are designed to stay in your head, so you can encounter issues once you pull them out. The most common being bleeding, bruising, pain, swelling, Hope that's been helpful. Lesson 2 completed.
Do you have an interview for medicine, dentistry, or veterinary school? The interview is the final hurdle of your application, but also the most competitive. Are you nervous about your interview or unsure where to start preparation? Here's where we can help. With a few clicks, you'll get access to 100 Medic Mind video tutorials covering 10 hours of theory, 150 MMI stations, live weekly webinars, and more. You'll get a breakdown of all the topics interviews typically cover and real-life MMI stations. Our award-winning interview course is trusted by over 12,000 students in over 37 countries and has been written by official medical school examiners. So, what are you waiting for? Get started on our course today.